Hi, my name is Brandy Beavis, and I am a Health Promotion and Research Analyst with Region of Waterloo Public Health. We actually have two health units working on this project together, Region of Waterloo Public Health and Wellington-Dufferin-Guelph Public Health.
And I am Bo Shane. I'm an environmental health specialist with Wellington-Dufferin-Guelph Public Health, and we were thrilled to partner with Region of Waterloo Public Health to undertake a climate change and health vulnerability assessment.
Region of Waterloo Public Health and Wellington-Dufferin-Guelph Public Health work together to jointly apply for the HealthADAPT Program funding from Health Canada. The funding allowed us to hire an external consultant to help us with this work. We're working with Health Canada. Through Health, we are collaborating with Dr. Chris Busey, a professor from the University of British Columbia, who specializes in climate change and health equity research. The purpose of our climate change and health vulnerability assessment is to evaluate the health risks associated with climate change locally and to present those risks for our two jurisdictions. The vulnerability assessment focuses on addressing rising temperatures, extreme weather, and the impacts to air quality, vector-borne disease, food and waterborne illnesses locally, as well as mental health impacts from climate change. The key goals to our project are to reduce the health risks and strengthen the resiliency to climate change variability currently and also to future climate change impacts to our community. We would like to increase public and stakeholder awareness to climate change impacts locally and to provide recommendations based on local evidence on priority adaptive measures that stakeholders can use to help build resilience in our community and our local health system. Our Climate Change and Health Vulnerability Assessment is a baseline collection of data on the health risks related to climate change for our two local public health unit jurisdictions. We share information about climate projections, vulnerable populations in our community, and some ideas for adaptation measures for stakeholders in the community moving forward. Without the funding from Health Canada and the HealthADAPT program, there's no way we would have been able to do all that we've done in the last 3 years. One major lesson learned through this experience was understanding the importance of having at least one full-time staff member focused on the project. There were an awful lot of moving parts, and we needed one person to be able to stick handle everything. Lots of different partners were involved, and that was really important along the way. Another lesson learned was related to documentation, and this was particularly important because with the length of this project, it's about 3 years long, there was some staff turnover. Some people left for new adventures and other ones left and came back again. Well, we needed to make sure that the documentation was good so that we could show what we were doing, why we were doing it, and how we got to where we are in the end. So documentation was key.
While taking time at the outset of any project to carefully scope out and define what will be included and not included in the project is always quite challenging, but critical to keeping any project on track. For a project aiming to assess and better understand risks posed by climate change to health, which is potentially an incredibly broad and all-encompassing topic, it becomes that much more critical to take time at the outset of the project to consult existing toolkits and frameworks, work that's going on in other jurisdictions, to really carefully lay out and define the project's scope, and then doing your best to stick to that scope will potentially play a huge role in keeping the project on track.
There's a lot of great work that can be focused on with respect to climate change and health from a local health authority perspective. But when thinking about specifically developing a climate change and health vulnerability assessment, one of the things that we felt was most impactful was having a lot of hands on deck. We were so grateful to have Health Canada and Dr. Busey helping us out and preparing the bulk of the report. They did the data analysis, data collection, report writing, etc. However, there was a lot of work that needed to be done from a public health authority perspective as well. As public health staff, we needed to source out data from our health units, determine which data was relevant for our report, describe all of the programs related to climate change and health that we were studying, employ our internal specialists such as epidemiologists and other various content experts, connect with our communications teams, and collaborate with other external sub-consultants such as designers, evaluation specialists, and master students for the various components for this project. So there was a lot of work for all players involved, and we are so grateful for everyone's help in this project. We will be launching our Climate Change and Health Vulnerability Assessment on our two public health websites, Region of Waterloo Public Health and Wellington-Dufferin-Guelph Public Health. Be sure to take a look there for the report itself. We will also be sharing information through our social media thread, so please be sure to follow Region of Waterloo Public Health and Wellington-Dufferin-Guelph Public Health. We'll be sharing information on Facebook, Twitter, LinkedIn, so be sure to follow along. We are really hoping that the information shared in our Climate Change and Health Vulnerability Assessment will be used to inform climate change work going on locally. We'll be sharing information via presentations with stakeholders, and if you're interested in any of this information, please be sure to reach out as well.
So this work really pulls together and highlights local data relevant to climate change that will help inform and shape climate change adaptation initiatives that are underway or those that are under development throughout the region. We have several stakeholders who are just launching their adaptation planning work as we speak. So it's been really exciting thinking about shifting gears towards taking what we've learned to support the foundation and growth of new adaptation initiatives, and also strengthening the many existing programs that are already running out there and playing a critical role in building resilience in our communities.
We are excited to share that our Climate Change and Health Vulnerability Assessment was launched to partners and the public in the spring of 2022. You can find the report along with accompanying resources like our climate science report and our infographics on our two public health websites. We hope that you find these resources helpful and encourage you to contact us anytime with questions. We'd love to hear from you.